destruction of RBCs are occurring in both ineffective erythropoiesis and hemolytic anemia, then how they are different actually. This is a commonly confused term. One is ineffective erythropoiesis, another is hemolytic anemia. I would also discuss that what are the 4 words that is required to correctly understand the concept of hemolytic anemia. And I will also explain that what is the precise difference between hemolytic anemia and ineffective erythropoiesis. And then I would connect this concept on how to correctly approach the classification of hemolytic anemia. That is basically I am going to do in this short session. So let's begin with the first thing. The first thing is that if the RBCs are getting destroyed, particularly the RBC precursors, within the bone marrow, the destruction is occurring within the bone marrow, then we use the term ineffective erythropoiesis. If the RBC precursors are getting dying within the bone marrow, we cannot use the term hemolytic anemia. Hemolytic anemia's definition requires 4 keywords. What are the 4 keywords? Premature destruction of circulating RBCs, red blood cells, which are fully mature red blood cells. That is the characteristic feature of hemolytic anemia. That means red blood cell in mature form has come into the circulation. They are circulating in the blood vessels, peripheral circulation, and they get prematurely destroyed. Prematurely destroyed means they are supposed to live for 120 days, but rather living their normal lifespan of 120 days, which is 4 months, they die much earlier. Typically they die within 10 to 50 days, 50 days. That means for roughly 1 month. So rather than living for 4 months, they die within 1 month or less than, even commonly less than 1 month. So these are the 4 words. So what is hemolytic anemia? Hemolytic anemia is a kind of anemia characterized by those 4 words. Premature destruction of the circulating red blood cells, which explains that. And if the immature RBCs, in certain conditions they die, they get destroyed within the bone marrow. For example, in megaloblastic anemia it happens in thalassemia. That is called ineffective erythropoiesis. Ineffective erythropoiesis means actually, let me give you an example why ineffective erythropoiesis occurs in thalassemia. Thalassemia, what is beta thalassemia? Beta thalassemia, what is occurring that beta thalassemia means there is not beta chain is there. So alpha chains are too much and beta chains are lacking. So alpha 2 chain would bind with another alpha 2 chain. This alpha 4 chain would start to precipitate within the growing RBC precursors in the bone marrow. And that is toxic for that RBC precursor. So they usually, these immature precursor cells in the bone marrow, they die within the bone marrow in the thalassemia. So thalassemia, significant destruction of RBC precursors occur within the bone marrow, and that is called ineffective erythropoiesis. If you read beta thalassemia really nicely, you understand that major problem is ineffective erythropoiesis, and later some of the RBCs which come out, they get destroyed, peripheral circulation, that is hemolysis is occurring. But majority, the cells, they occur in ineffective erythropoiesis. Similarly, in megaloblastic anemia, ineffective erythropoiesis occurs. So the fundamental concept which I am telling you, you should understand right now, that if the destruction of RBCs are occurring within the marrow, within the bone marrow, then we should use the term ineffective erythropoiesis. If the mature RBCs, when they come out of the bone marrow to the peripheral blood in the circulation, they get prematurely, rather than living for 120 days, they die much earlier. That condition should be called hemolytic anemia. Now, I'm going to connect this with the basic classification also. So, as you right now understand that one way to look at the classification of hemolytic anemia is that where these RBCs are red blood cell, mature RBCs are getting destroyed within the bone, within the circulation. Because I mentioned that in hemolytic anemia they should be destroyed in the circulation. If they are getting destroyed just within the peripheral blood, we call it intravascular. And if they're particularly getting destroyed within the spleen, sometimes in the liver also by splenic macrophages, particularly in the spleen, that we call extravascular hemolysis. But I personally prefer the classification of hemolytic anemia, where there's hemolytic anemia is classified into intracorpuscular causes and extracorpuscular causes. I feel it's more scientific and logical actually. Intracorpuscular causes means the problem which is leading to hemolysis in the peripheral blood, the cause is within the RBC. And another side, the problem is coming from outside, which is extracorpuscular. Corpuscle means cell actually. So, what are the causes which can cause hemolysis within the RBC? To understand this, it is very simple. What is red blood cell? A bag full of hemoglobin. Only sole purpose of this cell, as I mentioned many times, that is to carry hemoglobin. That's why the cell has, the mature RBC has no nucleus also, because it would take space. And in that space you can put more hemoglobin also. So mature RBC, usually in a red blood cell, there are three components. There is a bag should have cover, like any bag has a cover. So RBC has a cover, that is membrane. Then inside there is a lot of hemoglobin, and for the basic survival there are some enzymes are there. So RBC, a mature RBC, basically cell has, red blood cell has three component, key component actually. One is membrane, hemoglobin, and some enzymes. So if any problem which is arising within the red blood cell, and that can potentially cause hemolysis, could be divided into three causes. So intracorpuscular causes or intra-RBC causes which is leading to hemolysis, there could be, cause could be membranopathy, cause could be enzymopathy, cause could be hemoglobinopathy, because only these three things are there in the within the red blood cell. Membranopathy could be hereditary spherocytosis, hereditary lymphocytosis. Enzymopathy, where enzyme defect is leading to hemolysis and the problem is within the RBC. The enzyme could be glucose 6-phosphate dehydrogenase, G6PD, could be pyruvate kinase. Sometimes the problem in hemoglobin, that could lead to hemolysis, and the problem is within the red blood cell. This is called hemoglobinopathy. It is also intra within the RBC. So this group of classification of hemolytic anemia, the problem which is leading to hemolytic anemia, the problem is within the RBC. And this could be, as I mentioned, membranopathies, enzymopathies, or hemoglobinopathies, because RBC is basically made of three things. And sometimes what would happen, the hemolysis in the peripheral blood would occur due to other reasons. The problem is not within the red blood cell, but the problem is coming from outside. Let's say you are healthy right now, you have healthy RBCs, you get infected by a parasite, let's say malaria. Malaria infection causes hemolysis in the peripheral blood. The problem was not initially within the RBC, the problem is coming from outside. That is the extrinsic causes. Or another classic example of extrinsic causes causing, extrinsic means extrinsic outside to the RBC cause causing hemolysis, is microangiopathic hemolytic anemia. Again, the name is self-explanatory, microangiopathic hemolytic anemia. Micro means small, angio means blood vessel, pathic means that small blood vessel is pathological, which is leading to hemolytic anemia. Typical example we get in DIC or TTP, thrombotic thrombocytopenic purpura. So in this condition, what usually happens, thrombotic angiopathies they say. What usually can happen, that HUS, what usually in GAP and hemolytic uremic syndrome, what usually is happening, that within the small blood vessels there is a blood clot forming unusually. And when the RBCs are coming at a high speed, they are hitting that blood clot within the blood vessel, small blood vessel, and getting hemolyzed. So the problem is not within the red blood cell actually. So it's something like that, you are a very fast supercar, sports car is coming at a high speed on a national highway in the dark at night, and somebody has put a very large stone in that on the road. So the driver could not see that large stone, it hits that, and ultimately the car, there is a boom, there's an accident, the car ruptures, hemolysis occurs. So in this case, what is happening is the same thing actually. RBC is coming at a high speed, there is a blood clot, like that stone is there within the blood vessel, it hits that, and there is a hemolysis occurring. But again, there was no, intrinsically there was no problem within that red blood cell. So the problem was outside, there was a blood clot in the small blood vessel. So it's also an example of the problem is outside to the RBC, which is causing hemolytic anemia. So I feel that this is more logical approach to classifying hemolytic anemia, which is intracorpuscular causes and extracorpuscular causes. I feel it's more scientific and logical, but it's my personal opinion. So again, this way you can classify the hemolytic anemia into the problem is within the RBC, and problem is coming from outside the RBC. Within the RBC could be membranopathy, enzymopathy, hemoglobinopathy. Membranopathy, as example, would be hereditary spherocytosis, elliptocytosis. Enzymopathy, G6PD deficiency, pyruvate kinase deficiency, hemoglobinopathy, like sickle cell anemia. Outside causes could be microangiopathic hemolytic anemia, parasitic infection. And lastly, coming back to the main thing, that hemolytic anemia is characterized by premature destruction of peripherally circulating red blood cell. It is different from ineffective erythropoiesis, where the destruction is occurring within the bone marrow. Thank you so much.